Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy practitioner, and my jester co-host, Dr. Jason Martin. He's a board-certified plastic and reconstructive surgeon. It's April Fool's Day, Dr. Martin. I hate all of the April Fool's Day things that people put up.
I know. I was thinking to myself, what can I say? I'm just going to quit the podcast on this feed, and then you're going to be like, no, don't quit. And I'm going to be like, April Fools. Yeah. And it never works.
No. Like, here's a sonogram picture of the baby I'm not pregnant with. Yeah. An engagement ring that's not mine. Right. Yeah, no, I hate all those things. So,
but it was fun when you were kids. I think it was fun.
Maybe. But either way, we are glad you're here with us for part 2.
We're celebrating.
Yes, this is part 2. If you left a comment or question, it might be in part 1. So go back and find part 1 if you did not already listen to that. You can find all of our social media handles right here, and also in the description box below. There are timestamps, so if you're looking for one specific question, your question perhaps, look in the timestamps and you can jump ahead.
Yeah, go back to part 1. You can hear us talk about nerd clusters.
Yes, gummy candy, all those things. So we have some great questions this time and some comments. Some of the questions are pretty technical. So you ready, Dr. Martin?
I'm ready.
Do you have your answering hat on?
I'm ready to go. I'm always ready to go.
All right.
I love these episodes.
So this first one was from episode 136, which was everything you need to know about brachioplasty. Judy R.A. Fat. I doubt that, Judy.
Yeah, you're not fat.
Yeah.
You're not fat.
But my grandma used to say, use not fat, use fluffy.
I hate to tell you, I think her last name is Rafat.
Judy Rafat.
Yeah.
Well, I'm sorry I called you Judy R.A. Fat.
But I mean, this is a plastic surgery.
Judy Rafat? Yeah. Yep. Sorry about that, Judy. All right, let's just move on from that. April Fools.
April Fools.
Okay.
Judy.
I can blame that instead of the weather like I was blaming on everything a month ago. Does it make a difference about being over 70 with wrinkly skin, but not a lot of overweight? So you got a lot of skin, but not a lot of fat.
Yeah. So we have a lot of these cases here. We have a very healthy clientele, people over 70. They don't have a lot of medical conditions. They're of normal weight, maintainable, healthy, normal weight, and they have loose skin and some soft tissue on the arms, but mostly loose skin. And we definitely do brachioplasty.
Especially over 60.
We just did it. We literally have a patient that Amy was taking care of. I just signed off in her note before this podcast. She was, upper 70s. She's in amazing shape and her results are amazing. So it's definitely doable. Now, as you age, your skin gets thinner. You can get stretch marks. It gets more translucent. So there are going to be some limitations of the brachioplasty for sure.
But still solves a problem.
It's still way better than having, bat wing arms. Mm-hmm. So nothing wrong with it as long as you're healthy.
Yeah. Awesome. Thank you, Judy. I appreciate your question. Yes.
Thank you, Judy Rafat.
Yes.
See, I know how to pronounce it.
Yes. This next one was also on the same episode. So still episode 136, everything you need to know about brachioplasty. And this was from Robin Rudolph. See that? I actually made that together. I didn't say RUDL off.
Rudolph.
7261.
Yeah.
Happy New Year, Amy and Dr. Jason Martin. Yay.
Happy New Year to you, Rudolph.
Your expertise and knowledge helped me more than you will know. I especially love that you both enjoy sharing your careers and sharing your unique personalities with others. That is a true gift. And Robin, I have to tell you, it was a complete coincidence. This weekend, I sent a text to Dr. Martin saying like just how amazing, how blessed we are to do what we do.
Yeah.
Like I'd just gotten off a telehealth follow-up with a patient who was just doing amazing. And like, it's not a show. Like I am excited every day to come to work.
Yeah, we have literally the best jobs.
Yeah.
So one of the reasons the nidus of this podcast was Nils, our producer, met us and he's like, man, you guys are awesome. We're super excited about what you do.
Go listen to the 100th episode to hear the story.
Right. And that is really our ethos about what we do. And Amy and I have been working together since the beginning of time, since the automobile became more prominent in this country. And I don't think that's changed. Actually, I think the older we get, and we're not old now, but we're middle-aged, the older we get, the more we feel that way.
Well, because the more we appreciate it.
Yeah, because the
more we live in that moment.
Right. And we have more and more examples of people that we changed their lives. We made their lives a little bit richer.
Well, that are just awesome people that we would never have met.
Also, name a job where you get thank yous. Thank yous from the heart. Thank yous that are truly sincere.
Oh, there's a lot. When I was a ski school teacher, I used to get lots of thank yous.
I don't know about that.
And then they'd throw up on me.
So
that still happens with adult patients.
It's so wonderful you say that's a gift that we're giving you, but actually it's a gift that people give us to let us do this for them. It is somewhat self-serving. We feel good when we do this. We feel good when we make people feel better. And that is a gift, right?
Or
so our patients give us a gift.
You save lives. I mean, you do breast cancer surgery.
Yeah.
Like, you're literally saving people's lives.
Yeah, that's true.
Yeah.
And the podcast is just we get thank yous from people we never meet. And
Yes.
you never actually work on, but they give them information. We empower them, and that's a whole other layer. Yeah,
the girl in Australia who feels empowered to go get a breast reduction.
I even get something out of that, and I never have to touch a syringe or a knife or any of that.
You have gotten fat on you though, so Nils, you're part of this.
That's true. I have got fat on my
He's
shoes.
not fat. You mean
during surgery?
I'm sorry, Nils, you're rough fat. You're rough fat. But you're talking about when we were doing the fat transfer.
Yeah.
Nils got squirted.
Yeah,
one of the hoses came loose.
Yep, he got sprayed.
No.
Yep.
Hey, it's part of the job.
Not as much fat as I've gotten on me. Trust me, I've had some.
I can't complain.
I've had some bad things happen to me. But thank you, Robin. We appreciate you so much. I mean, it really is the best job ever. It's amazing.
It is amazing.
Yep, it's amazing. Okay, before I start crying about that, let's go to the next slide. This was on the 2024 Mashup. There's a couple of these. This was from Catherine K0116. Yes! Exclamation point. I love the producer Nils mashup. You three are the best and crack me up.
Yeah.
The mashup is my favorite episode. And it doesn't get a lot of views because I think people don't know what it is, but it's the best.
That's so cool. I love it. Even to just comment on it is great.
Yes.
Yeah, we do those mostly for us. But yeah, I just put it out by itself so we can have
That's
it
like a condensed version of our relationship, though.
It's a whole year of podcasts in like 15 minutes.
Yeah.
That's how it came about, too. It was just like, this is kind of what we are, right? So, without all the technical stuff in between. So that's why it was so much fun to put together. So,
they're awesome.
Love it.
Yes. Thank you, Catherine. This next one was also from the Mashup. This was Annie Oakley, 379. This is great. Nice job, Nils.
Yay.
Way to go, Nils.
Love it. And love the username Annie Oakley. Love that.
Yes.
Gunslinging. Yeah.
Thank you, Annie Oakley. That's awesome.
Yeah. Nils does deserve all the credit for that. I mean, we could not do this without Nils and Sarah, but we'd be, as Nils mentioned, we'd be in a room talking to ourselves, and trust me, that happened during 2020, and it was literally the worst. It was awful. Don't ever want to do that again.
And the worst thing about it was we knew it was awful while we were doing it.
Oh, yeah. It was just, everything was awful.
There was no question this was not going to come out okay. But Nils was very graceful.
He was. And Nils, oh my goodness, Nils and I had to record a podcast without Dr. Martin. And it just so happened it was on a day that I had vertigo so bad that I could barely see straight. And I would never have been able to get through that without Nils. Oh my goodness, Nils. Like I literally, and Sarah was here that day too. I'm like, I can't even look at anything. Like I was literally just like looking at Nils. Like as long as Nils and I are in this, like I can do this.
So Nils was like the horizon. Yeah.
Yeah, you ever like? Oh, I do not recommend going back and watching that. The episode itself is amazing. Listen to it, don't watch it, because it hurts my soul to watch it. Yeah, you can see that I was not well, but listening to it, it sounds great.
Yeah,
just watching it, that's bad. So thank you, and thank you, Nils. All right, so the next one was from one of our YouTube shorts. This was great. This was also on TikTok. Is a deep plane facelift superior to a SMAS facelift? This was from Hove785. Hi, doctor. Thank you for this video. Is transoral subperiosteal mid-facelift considered a deep plane facelift? Does that method have any disadvantages? Oh, yeah. Would you recommend? That's my surgeon's method. I am also doing a temporal lift, eyebrows and cat's eyes. Also, do deep plane lifts require internal sutures? Thanks a lot.
Yeah.
So let's first talk about this transoral. And I think this subperiosteal.
Some periosteal, yeah.
Periosteum is the covering of bone. So I don't think she literally means under the bone.
Yeah,
I think she means supra, like above the
right.
the periosteum.
Yeah, so this question is a little bit confusing. With that said, what you're really saying is they're working in the deep layer. So
right, going in through the mouth though, because this is a thing that some doctors are starting to do.
And I do that all the time when I do facial reconstruction. The supraperiosteal area above the bone, the malar bone, the malar prominence, the cheek area, I access that through inside the mouth all the time.
To put plates in.
Put plates in, reconstruct it. And if you're going to do cosmetic procedures, you can do that route too. It's perfectly fine. In expert hands, it's going to be safe. The second thing is doing a temporal lift is fine. Doing eyebrows is fine. You can do a temporal lift and do supraperiosteal lifts. There's different planes that you can get into. You can use an endoscope. A lot of people do that. They'll do endoscopic lifts through the temporal area, which is the sideburn area above the ear. and gain access to that area. And then, going on to that, you kind of veered over into like how the foundational layer, the deep plane facelifts, or the SMAS, S-M-A-S. That's what we refer to. I have tons of videos on this on our YouTube channel. It's one of my expertise. And of course, any kind of SMAS procedure will involve some sort of suturing. So a SMAS lift, a SMASectomy, or a deep plane facelift will all lift up the SMAS and then secure it with sutures. So, and that's one of the things is people use this as a shield to do this stuff, to say, I do this better, or this kind of procedure. And there's benefits of every different procedure. There's also drawbacks. Mm-hmm. And so you have to balance those benefits and drawbacks and apply it to the patient appropriately. So you may be a candidate for this, sub or super periosteal approach through the mouth. By the way, when people talk about buccal fat pad excision, which we've never talked about in here, which is interesting, we should bring that up at some point. That's done through the mouth also. So it's kind of in a similar plane, the buccal fat pad, which is that fat pad around your mouth, lower cheeks. So all of these is just really dependent on your preoperative exam. And that's the problem. So if you just put out that everyone needs a deep plane facelift, or everyone needs a super periosteal approach or an oral approach, it's really not appropriate, because a lot of people may not even be a candidate for that procedure. Secondly, the data shows that as long as you address the foundation, do some lifting kind of stuff, that you're going to have a good result. Okay. How good that result is really going to be dependent on your surgeon's technique and talent.
And your presentation.
And your presentation. But at the baseline, you want your surgeon to say, okay, we're going to really address that foundation in a good way. And
skin laxity. And that, this is where I feel like, and I have frustrations with the verbiage around all of these terms, because people get so caught up on the verbiage of them and don't understand that you could call something whatever you want. If it doesn't actually address your problem appropriately, then who cares what it's called?
Right.
Like, it doesn't matter. There is no name of surgery that's going to give you the best result. The best result is done through the technique and actually addressing the problem you have, and it can be called nothing at all.
Yeah. Right. And the naming is really done for marketing purposes. Exactly. There are some technical things we do. And to be honest with you, the data is really confusing too. Again, someone who does facial aesthetics all the time, I'm an expert in it. I do reconstruction. I do tons of cosmetic surgery of the face, a lot more than most people. And I have different ways I do things, and I'm pretty facile with all that kind of stuff. Even when the people are kind of going back and forth with these words, it can even be confusing to someone like me, because it doesn't always make sense what they're saying.
Right. Like
the surgeons. Yeah. So in reality, you're going to have to address the skin, even with the deep plane, no matter what they tell you. You're going to have to address the foundation, okay, the SMAS. And then if you want to go even deeper, subperiosteal, do a lift there, or super periosteal. You want to do fat injections in that same area. You want to do a buccal fat pad excision. It's going to have multiple approaches. And FYI, if you go to an expert, I do all those approaches. And FYI, it's not hard.
And we don't call them weird things. And we just still call them a facelift. Literally,
I have no problems going in your mouth. None.
But is that the best option?
I'm saying if you need it. I have no problems going up in the temporal area and the sideburn.
But that doesn't change that doesn't change the surgery. Like calling it something. My point to this is calling it something else doesn't change the surgery if you're still not getting the surgery that you need. And
what is put out there, and this may be true if the person's not a facial expert, and that could be a plastic surgeon, oral maxillofacial surgeon, or an ENT surgeon, board certified. But they're putting out there is that I do this and other people don't, which is complete and utter BS.
Or I do this and it's better.
Right. If you're going to a facial expert, they should be able to do all these things and decide what you need. That is the difference. So there is no unicorn procedure. There is not. Now, are there people that can do a transoral approach better than others? Sure. And if they suggest that, ask them what the benefits are. Why are we doing it this way? Because that is a little more complex. And by the way, if you go through the mouth, Amy, what does it have a higher incidence of? Infection. Guess what the dirtiest place in the world is? The human mouth.
Yeah.
Okay. So we know that because when you do facial reconstruction and you put plates in, they have a higher incidence of infection if they have any kind of health problems. So,
yeah. I think the big thing here, though, is and this is why we put this video out, was to try and get people to stop focusing on these terms. You know, you could call a facelift anything you want. It doesn't necessarily change the surgery you're getting.
Right. A good surgery is the surgery you need with an expert that really knows what he's doing or she's doing.
Yeah, that actually addresses your problems, not just as some cool technique that you heard of or you think is your solution.
And by the way, I love deep plane facelifts, and there is some argument that they last a little bit longer than some of the other SMAS approaches, but not everyone even needs a deep plane facelift. That is erroneous. And I know I say that, and people are going to be like, well, he's just saying that. Well, no, I'm saying that because it's true. You don't have to believe me. And so why would you go pay for this extra surgery when you don't need it? It doesn't make any sense. If put it to orthopedic surgery, if you don't need your ACL repair or some tendon repair, why would you do that, right?
But what if you call it a super ACL repair?
Right, yeah. With like emojis and a fire emoji.
Then it's better. A reverse approach, orthoscopic ACL, rejuvenation repair.
So Hove 785, which I hope you mean like Jay-Z Hove, but I will tell you, it's a good question. And also being someone who is pro all these kind of procedures, pro, not against.
Yeah, if that's what you need.
But it's really about what you need. So this is a hard question to answer just because we're not really looking at you. I know that's
and don't get caught up in the verbiage. Yeah. Like the surgery is the surgery you need. I mean, if we start doing tummy tucks and calling them, unicorn kisses, it would still be a tummy tuck.
Yeah.
Each surgery should be named after the person getting their surgery.
Yeah, exactly.
That's all unique to that person.
Yeah.
So
if I get a tummy tuck, we're going to call it the Amy tuck.
The Amy tuck.
Yeah.
I'm getting the Nils lift.
Yeah, when I get my facelift, I'm getting the Amy lift. Yes, absolutely. I love that.
The Nils lift would just be shaving that beard. Okay.
Yeah.
That's all he needs.
Yeah. So yes, get the surgery you need, not the surgery that has social media buzz.
Okay.
All right. Next one. There's a couple, I think, from this one. Nope, just one. Pam Stoltenberg asks on episode 156, Everything You Need to Know About Facelifts Part 2. My surgeon said I won't have drains. Is that rare or should I be concerned? These are 3 questions from her, so let's just answer that one first. No drains.
No drains for a facelift?
For a facelift.
No, not a big deal.
Yep. There's reasons we use them. I'm sure there's reasons your surgeon doesn't want to use them, but every time we do.
So you want to talk about a nothing burger? Drains with facelifts. If you use them, they usually come out 12 to 24 hours. So it's like a nothing burger. If they don't use them, great. That's fine. It doesn't really matter. It's not going to affect the outcome, period. Now, having drains in place can be beneficial. If you have a little bit of bleeding, but not a lot, you can do some maneuvers where you don't have to go back to the operating room.
Well, so Dr. Martin, you say that though, but we use drains on our surgery. So that's a confusing statement to make.
Yeah, I do drains because I'm more comfortable with those. I have access to underneath the flap. It gives me flexibility within 12 to 24 hours if I need to do something.
Right. Takes the pressure off the flap overnight.
That's the only reason.
Yeah. But that's a good reason. That's what I'm saying. You're making that seem like it's not a reason at all, which is what you said. That's no reason at all.
It's not going to it's not going to be the definitive factor of the surgery. So if you're going to a surgeon, you're focused on drains, then you are completely and utterly off the property. Like you're not even focusing on what matters the most. Now, you can have reasons that surgeons like to use drains and reasons they don't. Drains are uncomfortable. That is for sure. They can bother behind your ears, but it's not so uncomfortable that people can't manage it. So, but if they don't use drains, what I'm saying is you can still have a good outcome. So I don't want Pam to be uncomfortable with that decision.
Right. So the next one, and I had Sarah leave this typo in because when I responded to it, it took me later. It was later when I realized that this was a typo. So is Boostba good protein drink?
Is that just Boost?
Looking for a low sodium diet. Is that correct?
Is that Boost like the drinks?
Well, so that's what I said to Sarah. I said, please leave the Boost a typo. I'll explain later. So when I responded, I said, I don't know what that is because I looked it up. I'm like, well, because you don't know where people are from. So I'm like, this must be something. And then I think she just put the B, it was supposed to be a space, is Boost A. So there's a B where there should be a space. So I apologize for my response to you, Pam, because I did not understand. But what I responded to her was I was not familiar with that drink. I would not recommend Boost. It was not one of the ones I recommended. I did recommend 2 options for her. The ready-to-drink protein shakes are not great quality.
Because they have carabin and all that kind of stuff in it, right?
They just have a lot of fillers that you don't need. They're not really a great source. I mean, they're fine in a pinch. And the one I like from Quest is actually very good. There's also one from Redcon 1 that I really like that is that's a whole food-based protein. But ultimately, they're expensive also, whereas you can get a big tub of Levels Whey Protein, which is our favorite grass-fed whey protein. It's what Dr. Martin and I use.
You can tell because my biceps are huge now.
Yeah, that you can mix with water or milk or whatever, put into a shake. It just gives you so much more versatility. So would I recommend these ready-to-drink protein shakes? Not unless that's literally your only option. I would not. A low-sodium diet, I don't think people should alter their sodium intake drastically around the time of surgery because it can mess with your electrolytes.
Some people can be sodium sensitive, but you were probably already on a low sodium diet.
That's why I said adjust your diet. Yeah. I don't want people making drastic adjustments to their sodium intake after surgery because you can have electrolyte imbalances.
Yeah, 100%. And by the way, low sodium levels post-surgery is life-threatening.
It's very bad. I mean, and electrolytes are one of the things I recommend for people after surgery. So I would not alter your sodium intake. Up or down after surgery, unless your doctor specifically tells you to. But in general, you don't want to just start doing a low sodium diet right before surgery if that's not what you've been doing for other health reasons. You should keep your diet the same. And then she asked, I'd like to know which pillow to recover from a facelift. And I said, here's the link. And the link is in the description box below because I get asked this a lot. Nice. And it is fantastic. And it's way cheaper. It's like $70 now on Amazon. And it is amazing. It's actually the pillows that I have in our hyperbaric chamber for bolstering too. They're that good.
You know how stupid we are? We can just start our own Amazon store. It's super easy to do. We could just sell all this stuff.
And what? Get like pennies when people buy it?
I know. But that's what people do.
Yes. Because they're making money.
Go to our Amazon store. But we don't.
Maybe I'll start an Amazon store.
No, we're not. We're not starting an Amazon store.
Levels Whey.
That sounds like a lot of work.
The Quest protein shakes, the MRE light. Yeah, all that stuff. But great. Squishmallows.
Yeah, we definitely have Squishmallows over there. We'd have our toilet extenders.
And So Pam, thank you so much. Those were 3 great questions. I really appreciate that.
Good job, Pam.
All right. We're going to take a quick break and we'll be back in just a moment with the rest of your questions. And we're back. And we're back with a really good one because this, if you listen to part 1, you know that Gummy Candy for Life is a future bikini competitor, which is awesome.
And she's her own coach.
She's coaching herself. So she left this on episode 186, which was Reddit, Will Plastic Surgery Make Me Happy? This was such a great episode.
So good.
We have a couple of comments on this episode. And she said, RNY improved my self-esteem 100%.
So
as I felt.
RNY?
Yeah.
Okay. Which is gastric bypass, which is weight loss surgery. Okay.
Yep. Right. As I felt free of the mental and physical burden of my body for the first time in my adult life. My plastic surgery was purely to be more competitive on the bodybuilding stage. That's why I brought that up. And my self-esteem was just fine prior to that.
Nice.
Right? And we talked, yes, you lost weight. Get rid of that loose skin.
Yeah. Sometimes some people that when they lose weight and they have a lot of loose skin, there's it's so exhilarating to remove it. But a lot of people feel like she does, where it's just I got to get this done. And I got to close this door, right? I just want to get this skin gone and move on. So they're already in a pretty good mental space.
And become a bodybuilder.
Yeah. I mean, the bodybuilding is amazing.
I mean, that's Gummy Candy. I'm sure you know this. There are shows that have transformation categories. You should enter those as well. Awesome. Yeah.
Is there categories for plastic surgeons with bad personalities?
Yeah. But bodybuilders don't tolerate that kind of behavior.
Okay, just asking.
This is also a great example of that no amount of exercise fixes loose skin.
Oh, yeah.
Exactly.
Right? So it's you go from that to a bodybuilder, you still need to get rid of that skin. Yep.
Don't tell the people at the gym that, with the one that want to get you to sign up for 10,
No, it's more don't tell the people at the medical spa that.
Or the medical spa too, yeah.
All right. So on the same episode, we had a comment from Emmett Carlson, 2739.
Yep.
Plastic surgery definitely made me incredibly happy. I rejoice over my great results every second, minute, and hour of every day.
That's awesome.
I had plastic surgery on my arms, a tummy tuck, and a butt lift over a period of 3 years, which is awesome. You spaced that out. I had this done because I decided to lose weight and work out. I went from 96 kilograms to 68 kilograms and had loose skin. Quick math, Nils. 96 kilograms, that is 200 pounds, give or take. Yeah?
Right.
Down to 68, which is going to be 150? 1 times 2.2?
Yeah. It's about 65 pounds that patient lost.
Well, I love this. Literally, decided to lose weight and did. And that is amazing. And then got surgery.
Yeah.
Yes. And rejoice over my great results every second, minute, and hour of the day, every day. That is incredible.
What was the lower weight?
68.
68, yes. 216 was 98.
So 216 went down to
268, you said?
Why did we change our systems in America?
I know.
That's just
Or even just know it offhand.
I know.
Yeah, 149, 150.
See, I'm good. Exactly. I can convert. Right, well, because I do conversions for dosing meds.
Yeah, so it was about 70 pounds.
Yeah. Okay. Amazing. So congratulations. And thank you for commenting on this episode. So awesome. One more from this episode. I had to include these because they were just all so uplifting. So this was from Kimberly Poe 517. Same episode. At age 38, I am the happiest I've ever been with my body after my breast augmentation and lift with the magical Dr. Martin.
Who is that guy?
I'm much more proportionate and feel so feminine and sexy now. Hands down, the best decision I've made for myself. And at 38, I mean, like, this is why when people we say this on our myth busting episodes that they think they need to wait to have surgery.
No.
It's like, no.
Why wait?
Like, have it now. Like, yes. Like, Kimberly, this is amazing. Yeah. So incredible. And Dr. Martin is pretty magical.
I am magical. But I have to tell you...
put the magician hat on him.
Yeah. So magic is a two-way street, right? So you can't be a magician without having an audience and the audience, blah, blah, blah. So it's a big part of this is truly our patients, especially this patient.
Well, she said you're a magician, not a wizard. You didn't summon a person.
Yeah, I know. So
know the difference, Dr. Martin, between a magician and a wizard.
So it's so funny with plastic surgery because there's so much a part of this is technical and it's very myopic, or you're very focused into this one thing.
Well, yeah, because you're, taking somebody's life in your hands.
Yeah. And so this process becomes very insular, but then the recovery part and seeing how happy they are brings out the whole human part of everything. And that's sometimes the best part. And especially when you get comments like this, which makes plastic surgery so worth it for me to do and Amy to do, but also as a field of practice. And I'm so proud of it. I'm so proud that we get to touch people like this. It's so awesome. So, and I didn't read this.
I read it.
Okay. Didn't even know this existed.
Yeah.
The internet's an amazing place.
First comment from an actual patient on...
No.
We've had a few. Yes. Yeah. It's just... Yeah, we haven't had many direct shout outs to you in the comment section. Love it.
Dr. Martin's pretty awesome. All right. So this was going so far back in the YouTube... what do you call that? Universe? Archive? Yeah. Archive. In the archives. Julie L-16Q.
Was this our BodyTite thing? Or AccuTite or whatever?
It wasn't even AccuTite. This was our YouTube live. Dr. Martin discusses BodyTite. This was from 2017.
So this is where we went to...
it was here. We did it at the front desk.
We went to the Grand Canyon with the family. The kids were young, and we drove back. And I think this was like literally right when I got back.
I don't know that backstory, but either way, we went live. Yeah. Dr. Martin drew on my arms, and then I went to the grocery store after with all these markings all over me. And someone asked what happened to my arms, and I was like, "What do you mean?" And I was like, "Oh, yeah, that's right." Cover that up. This was the question: can you have BodyTite without liposuction? And this again is somewhat of it's not really a trick question, but it's not really. And this is what I said to Julie. If you're having BodyTite, you need at least a little bit of suction to aspirate out the tissue that has been obliterated by the energy.
Yeah, the non-viable stuff.
Right, because we're assuming that you're doing BodyTite on an area that is big enough for BodyTite and not a better candidate for something like FaceTite or AccuTite.
And BodyTite's not really good for places that don't have fat.
Because it needs it. And also, if you don't have any and you just have loose skin that you're trying to address,
you should just do it externally. I mean,
there might be a better option, right? Or you might just need formal surgery.
Yeah.
So if something is a really little area, like there are doctors who don't aspirate after FaceTite.
Yeah.
And
AccuTite.
You don't aspirate at all after AccuTite.
Yeah.
Like the lower eyelids or the hands or the labia, you don't aspirate those areas. So the size of the area is going to dictate the need for aspiration.
Yeah. And theoretically with BodyTite, you can do it without aspiration, but it's not really meant for that. BodyTite is really meant to be combined with liposuction.
Yeah.
Even if it's just a small amount of liposuction. Also, the act of taking a cannula and rubbing it underneath your skin also tightens your skin. So it'll potentiate the skin tightening effect of BodyTite.
Yeah.
So rare is that time. Every now and then we'll do it like in a little area, just get some skin contraction. We don't do this in the office very often, but then you can sandwich it with energy on the outside, Morpheus 8 on the outside, BodyTite on the inside, hypercharge the skin tightening. Skin
tightening technologies is a more recent video than the one you watched.
Yeah.
Still not that recent, but more recent.
So funny.
Yeah. I mean,
and was there any kind of quality to the video that she was watching?
It was recorded on my laptop. So the quality was bad.
Is there anything worse than a laptop camera from 2016?
Right. It was on an old computer. But something else,
2 hertz,
Something else to keep in mind, Julie, is that this area also needs to be temessed if you're doing BodyTite because it's internal. So you would at least want to get out some of that anesthetic fluid. I mean, there's, as I said, as Dr. Martin reiterated too, the size of the area is really going to dictate the technology that you're going to use. And if you're using BodyTite, you've got to assume that it's an area at least big enough for BodyTite. And there's, even on a very tiny person, going to be some benefit of doing some aspiration of even just a little bit of that subQ fat.
I aspirated everything just to get the skin tightening benefits of that.
The skin tightening, get the stuff out of there, get all that coagulant out of there.
Heal faster.
Yeah, you're going to heal faster, less risk of seroma.
If you leave all that kind of mushy,
burned
fat cells and tissue, that's very inflammatory.
Juice box.
Yeah,
you turn into a juice box. Previous questions from listeners.
Yeah, that's OG.
Yep, that was Reddit. That was Reddit Tummy Tucks. The juice box comment, the best. You squeeze a juice box. But great question, Julie, and thank you for going back in the archives because man, that brought back some memories. Yes. Love it.
Wouldn't it be funny if she went back, she watched that video, and she's like, well, this is what the channel is. Really crappy video quality.
It's not that bad.
It's not horrible.
No.
I'm just saying, and like I would do that. I'm like, that kind of crappy video quality. Good people, good information. I'm done. And then she did not even click on the video with the really good thumbnails and the amazing production on it.
Well, this is the same thing as the person who said we were having too much banter. If you can't make it past the banter, then you're not going to get the info.
Yeah.
All right. So the next episode, still way back in the archives, was episode 37, our very first video about tummy tucks. Yeah. This is from BojiBear7957. What type of stitches do you do for the rectus diastasis? Yeah. Are they individual? Or if it breaks, it all unravels. So good. Do they stay in permanently or do they eventually dissolve? This is specifically the rectus.
By the way, there's really no definitive answer for this. So for me, I do O-loop nylon. So it's a loop suture. It has no knot on it. Knots are the weakest point of a suture, and that's running. So like a whip stitch, a baseball stitch above and below the belly button. And then on top of that, reinforce it sometimes with interrupted sutures like you're talking about. So a couple above, a couple below. Or I'll do a barbed suture that also does not use a knot and is permanent. I like permanent sutures in the abdomen. We've had a few problems with permanent sutures, but that's only a couple patients I can think of.
Yeah. There's only 2 I can think of.
Yeah, and the permanent sutures, by and large, are what you would use. I mean, and you would know, like I'm initially trained in general surgery a long time ago. And then I went on to plastic surgery, which was very helpful because you would never use absorbable sutures in a hernia repair to repair something because it wouldn't work unless you're using a graft as the primary mechanism of supporting that hernia repair. Well, we don't like using grafts on the abdomen because you can actually palpate it or feel it underneath the skin. So the sutures, from my perspective, most people are like this, would use permanent sutures, multi-layered. So running and maybe interrupted on top. So it's a good question.
Yeah. And then the closure of the actual tummy tuck incision itself is definitely going to be a multi-layer closure with dissolvable sutures and then even maybe a couple of externals, like lots and lots of sutures. Someone asked me this week, one of the patients that you're asking me about, asked me how many sutures they had. I mean, it was for a face and neck lift. I'm like, including internal, external, the brow, the eyes, everything. I'm like, well over 100.
Yeah.
It's a lot. So you think a tummy tuck? I mean, same thing. Like, man, we do a lot of stitches on a tummy tuck.
Tell her I put 10 to the 12th sutures in.
Yeah, like lots. Lots. Yeah, as many as it needs to be. But that was a great question. And that was our last question.
Oh, that's too bad.
We made it to the end. I know. There were such good ones this time, though. They were such great questions.
Really good. I mean, they get better and better.
Yeah, they really do. So these episodes, as I always say, we could not do them without you, the listener.
Right.
Because we'd be sitting here talking literally to ourselves.
So my dream is to grow this podcast over the next 5 years and at some point have a live event. And maybe, by that time we'll have, enough of people that could fill a small place.
Well, I mean, we could absolutely do that at one of the plastic surgery conventions right now.
Oh, God. I do not want to deal with those people.
Well, no, but it would be with, people.
A bunch of suit wearing, look how great I am coming. Deep plane's the only thing I do, people.
We could do it like a beauty convention or something like
that.
Yeah,
somewhere like that.
Holistic.
Even worse.
Oh, yeah. I don't know. I work with a lot of doctors. I don't know. A room full of doctors is pretty bad.
It's boring.
Only thing worse, Nils, is a room full of doctors who think they're plastic surgeons and aren't. Only thing worse than referral plastic surgeons.
Scratch the idea of the live events.
I'd love to see you.
Maybe we'll just do it with us three outdoors somewhere.
Yeah, we just gotta find the right venue where people would be interested in doing
in the outdoors. Yeah.
We gotta think about educating people.
I'm thinking more that we need to do some type of like company retreat podcast where we're in a tropical location.
Oh, I'm digging that.
Yeah.
Like Costa Rica or something like that.
Yeah, let's go interview a plastic surgeon from a different country.
Oh, I would love that. And I know him.
This is a write-off.
Yeah, I know.
Exactly.
Yeah.
I already got the names.
Yeah.
There you go.
All right. Well, thank you all so much for listening. If you made it to the end of this episode, I really appreciate you. I appreciate you hanging in there with the banter. And I hope you found our answers to other listeners' questions informative. I love the questions. They help us kind of understand what you guys want to know. And you can help me even more by leaving me a comment or shooting me a text or leaving me a voicemail at 303-630-9038. You can find us on all social media at Beauty and the Surgeon Podcast and at Jesse Martin, MD.
And I am not the only magician out there. So if you live in a town or a city, hopefully a city, and you have resources, there's other magicians out there. And like our patient said, plastic surgery, it can be so invigorating and transformative. And if you're watching these things because you're interested in plastic surgery and you're sitting on the sideline and you're like, I don't know, just hopefully we educate you enough where you can have the confidence and go do what you need to get done.
Yes. You got one life.
Yeah,
one life. Most of it. All right. We will see you all here next time. It'll be tax day. We go right from April Fool's to tax day. Can we make that the April Fool's Day? God. Right? As everybody has an ulcer now?
Yeah, it just made me feel like I
know. It like gave me instant like I'm like, oh.
I got to go.
Seriously, we're all like, ugh.
I'm going to go throw up.
Seriously. Okay. All right. Bye, guys.